If you have a disc bulge, herniation or sciatica and you feel confused, scared or stuck, this video is for you. Nothing here will be rushed. I will explain what is happening in your body in a simple language so you can finally understand your pain. Most people are afraid because they do not understand what they are feeling. Fear increases pain. Understanding reduces it. A spinal disc is like a cushion between the bones of your spine. When that disc bulges or herniates, it can press on a nerve or leak inflammatory chemicals near the nerve. The disc itself often does not hurt. The nerve reaction creates pain. That nerve travels from your lower back into your leg. That is why pain can shoot down the leg, burn, tingling or feel electric. This is called sciatica. Many people think pain means damage is getting worse. That is actually not true. Pain often means the nerve has become sensitive. Inflammation lowers the threshold of the nerve. That means normal movements start to feel dangerous. Bending, sitting or stretching suddenly feels threatening. This is why symptoms change day to day. Some days feel better, some days feel worse. That does not mean healing stopped or damage increased. It means sensitivity is changing. This also explains why your MRI can look scary, but your symptoms do not always match it. Many people have a disc bulges and feel no pain. Pain depends on nerve sensitivity, not just structure. Now, let us talk about why common advice often fails. Stretching feels logical, but stretching pulls on the nerve. An irritated nerve reacts with more pain, not relaxation. Strengthening too early increases pressure on the disc. Pressure on a sensitive disc increases irritation. Random exercises change spinal load every day. The nervous system needs predictability to calm down. Random load creates confusion and keeps pain active. So, what actually heals a disc problem? Recovery works in phases. First comes understanding. If you don't understand your pain, you will fear every sensation. Fear increases muscle tension. Tension increases pressure. Pressure increases pain. Second comes calming irritation. This means removing movements and positions that spike nerve pressure. This is not rest forever. It is load management. Third comes restoring control. Control means your spine can handle basic movements without symptoms escalating. Fourth comes restoring mobility. Mobility is earned gradually, not forced. And last comes strengthening. Strength protects the spine only after tolerance exists. If you skip phases, the body pushes back. If you respect the order, progress becomes predictable. If this video helped you understand your pain better, I have a free disc recovery plan linked below. Start there. And if you feel stuck or overwhelmed, you can also apply for a one-on-one call so we can look at your situation personally.